Well, it touches every single one of us, especially when it comes to our health. Our sources today are painting a pretty stark picture. It looks like a direct link between former President Donald Trump's renewed tariff agenda and a rapidly worsening crisis in the U.S. healthcare system.
Yeah.
So our mission for this deep dive is really to understand how this bold economic push, aimed at bringing manufacturing back to America, seems to have led to what's being called a medical supply emergency. We're hearing about massive price surges, immense pressure on hospitals.
And what's really fascinating here, maybe fascinating isn't the right word, striking, perhaps,
Right.
is how quickly these seemingly distant economic policies can create such profound, such immediate impacts on something as absolutely critical as healthcare.
Yeah, absolutely critical.
This isn't just about trade deals on paper.
Right.
It's hitting the day-to-day infrastructure of how we actually care for people.
That interconnectedness is definitely key. And to see how quickly it's showing up, maybe we should first just lay out the details of this renewed tariff agenda from President Trump.
Good idea.
So as part of his 2025 campaign, his economic revival platform, he's been pushing for these, massive new tariffs on imported goods, pretty much across the board.
And specifically for healthcare, which is our focus, the sources really highlight a sharp increase on medical imports. We're talking key suppliers here, China, India, Germany. And what's crucial to grasp is just the scale of our reliance right now. Those three countries alone, they supply more than 70% of America's pharmaceuticals and medical devices.
70%.
Yeah. It's not just, TVs or sneakers.
Yeah.
This is the actual lifeblood of our medical system.
Right. And his message, Trump's message, has been really crystal clear on this. He's quoted saying, "We will not be dependent on foreign nations for anything, especially when it comes to our health." So the stated reason, the rationale behind the tariffs, is basically fostering domestic independence in these critical sectors like healthcare, bringing production home.
Makes sense on paper, perhaps. But as these tariffs has started to actually, take hold, the healthcare providers, the folks on the ground, they started sending some very dire warnings almost immediately.
The reports we've seen are pretty stark. Some providers are describing it as the system is starting to crack. That phrase really jumps out.
It does. It paints a picture.
It really highlights the on-the-ground reality of what this means.
And this isn't just like one or two stories. Hospitals and clinics in, the sources say, more than a dozen states are reporting extreme price hikes for absolutely essential items.
Like what kind of items?
We're talking everything from basic surgical gloves, oxygen tanks, IV bags, all the way to diagnostic kits and even, critical life-saving medications.
Wow.
And the prices for some of these supplies, the sources indicate they've actually doubled or even tripled in just a matter of weeks.
Doubled or tripled?
Yes.
In weeks?
Yes. And the insight here isn't just the tariff cost itself. It's exposing this inherent fragility, in a supply chain that we've built globally, optimized for efficiency.
Right, for cost.
Exactly. Built for efficiency, maybe not so much for resilience. And that seems to be the core vulnerability these tariffs are hitting hard.
That's a huge impact. And it's not just a few things either, is it? There's data from a nationwide coalition of medical purchasing officers showing insulin costs surging by 45%, basic antibiotics up over 60%.
60% for basic antibiotics.
Yeah. And chemotherapy drugs, which often rely on these incredibly specific ingredients from overseas, they're either delayed or just becoming completely unaffordable.
And the real-world impact of that?
Yeah.
Well, it's hitting patients and providers really hard. Our sources are showing doctors in, say, inner-city hospitals.
Yeah.
They're being forced to delay procedures, reschedule cancer treatments, sometimes even ration basic medication because they just can't get it or can't afford it.
Rationing. That's serious.
It is. And it's hitting rural areas, too. Community clinics, states like Mississippi, Kentucky, parts of Arizona, they're reporting their monthly budgets just can't cover basic operations anymore with these new costs.
They're immediate access problems.
Exactly. Immediate access issues are cropping up.
And it's not just the hospitals feeling this, right? Pharmacists, too.
Oh, absolutely. Pharmacists are sounding alarms. They're noting shelves emptying faster than they can restock. And independent pharmacies, the ones often in low-income neighborhoods, they're facing this impossible choice.
Which is?
Either raise prices dramatically, which pushes essential meds out of reach for their communities, Or, in some cases, they're just shutting down entirely.
Just closing their doors.
Yeah. And this has escalated now to the point where the American Medical Association, the AMA, they've issued this rare and really urgent statement.
Okay, what did they say?
They said directly, these tariffs are not strengthening our health system, they're suffocating it. We are on the brink of a national healthcare supply breakdown.
Suffocating it. That's incredibly strong language from the AMA.
It's about as dire a warning as you can get from a major medical body like that. It really underscores how close the system feels to a breaking point for them.
And yet, despite that warning, that really stark warning from the AMA, our sources show former President Trump is, well, he's standing firm, defending the policy.
Mm-hmm.
He was quoted at a rally recently saying, if prices are up, it's because of weak deals we made in the past. I'm fixing those deals.
Okay.
And he added, it's going to be painful, but in the long run, America wins. So he's framing this as, necessary pain for long-term gain.
Right. But medical professionals, economists,
yeah,
they're largely disagreeing with that assessment, at least when it comes to healthcare right now.
How so?
Well, their argument is basically even if the long-term goal is domestic production, fine. But the ability to actually ramp up that manufacturing fast enough
right now
to meet current demand, it just isn't there. And the why is really important here. You can't just, flip a switch on a global supply chain built over decades.
Yeah.
It's not just about building factories.
Yeah.
It's the whole ecosystem, right? Specialized chemical producers, precision component makers, the skilled workforce, years of tough regulatory approvals. That stuff doesn't just appear overnight.
Especially with the system already under strain.
Exactly. Especially given the existing pressures post-pandemic stress, staffing shortages we still hear about, rising insurance costs.
Yeah.
The system was already stretched thin.
And that sentiment, that frustration, it's echoed pretty bluntly by an Ohio hospital administrator we saw quoted.
What did they say?
They said, we can't treat patients with political slogans. We need medicine, equipment, and supplies, and we need them now.
Wow. That cuts right to it.
Yeah. For them, it's not theoretical economic policy. It's an immediate operational emergency affecting patient care right now.
And in response to this whole escalating situation,
yep,
the White House has apparently formed an emergency task force to monitor the crisis.
Okay, so they're watching it.
They're watching it. And while President Biden hasn't directly reversed the tariffs, sources indicate he's under, increasing pressure.
You do something.
Yeah, to invoke emergency powers, perhaps.
Yep.
To create exceptions for critical medical imports. Sort of a carve-out for the really essential life-saving supplies.
Interesting. And the division here, it isn't just Democrat versus Republican, is it?
No, apparently not. There's growing political division even within Trump's own party.
Really?
Yeah, some Republican lawmakers, especially from states with big healthcare sectors, think Florida, Texas.
Okay.
They're reportedly breaking ranks, demanding a pause on these specific tariffs.
Why? What are they worried about?
They're warning about, mass layoffs in healthcare in their states, collapsing insurance plans potentially, even a humanitarian crisis if things don't stabilize.
So it's hitting home for their constituents.
It speaks to that immediate local impact, definitely. Yeah. Which takes us to maybe the most critical part of this whole thing, the human cost.
Absolutely, because these rising costs, they're hitting the public hard, aren't they? People are already dealing with higher prices for groceries, rent, gas. Now, this spike in healthcare costs is hitting their wallets in, the most painful way possible sometimes.
Yeah.
For people who are uninsured or underinsured, even getting basic treatment could become unreachable.
Right.
And for those who rely on life-saving prescriptions every day, think about daily insulin user, people with chronic conditions.
Yeah.
The situation sounds like it's getting genuinely dangerous for them.
And the experts we're seeing quoted, they're issuing some pretty dire warnings, saying that if the administration and Congress don't act fast to stabilize these supply lines, maybe exempt critical imports from the tariffs, the country could face, and this is a direct quote, a full-blown healthcare collapse within months.
A full-blown collapse within months.
It's an incredibly urgent call for action. It emphasizes just how narrow this window might be.
The immediate consequences seem so clear then. Prices keep rising, delays continue, and the quote you mentioned earlier, the human cost will become unbearable. It paints a very stark, very real picture of what's happening on the ground.
Yeah, and I think the overarching message really pulling from all these sources is pretty undeniable. Yeah. It's summed up as, this is no longer about political ideology, it's about survival. Because when politics clashes with healthcare, it's the people who bleed.
Mm.
It just really underscores the kind of non-negotiable nature of healthcare needs.
Right.
And how quickly they can get tangled up in these broader policy fights.
So we've really unpacked this complex tension, haven't we, between these, ambitious economic policy goals on one hand and the very real, very immediate, and frankly painful impact on the nation's healthcare system and on its citizens. It's a powerful illustration of just how interconnected everything is.
It really is. And it leaves us and leads you listening with a pretty important question to think about, I think. How do nations actually balance that pursuit?
Yeah.
The desire for economic independence, for bringing production home. How do you balance that with the immediate, absolutely essential need for a stable, affordable healthcare supply? Especially when so many critical medical goods are, right now, sourced globally.
That's the core dilemma.
Yeah. What are the mechanisms we need? What should we explore to build more resilience into these vital systems, to stop them from getting caught in the crossfire of trade policy?
Sure.
And ultimately, how do we make sure that access to health never becomes just another political casualty?
Guys, thanks for watching. Stay updated with GlobalScope 360. Thank you so much. Subscribe to my channel and click the bell icon.